I'm Dr. Melita Tate, and I'm hosting our podcast, Conscious Medicine, for our patients and their families and the greater Tulsa community. Our goal is to take inspired action towards our health. And in order to do that, we want to have as many avenues as possible, make those available for each of us so that we can kind of get our mindset lined up and be able to not only just get our bodies doing what they need to do, not only just taking the medications or doing the regimen that our primary care physician may have assigned us, but also taking steps ourselves to put our mindset in an aligned place for our healthcare goals. So to that end today, I have invited one of my very favorite people on the planet and chiropractor and friend, Dr. Larry Ward with Natural Health Associates here in Tulsa. I want to introduce him to my patients' families, the greater Tulsa community, and we're going to have a discussion about, what chiropractic is, how it can help us take aligned action towards our healthcare goals. And I've got just a moment. I wanted to say a few things about Dr. Larry Ward. He is one of the most caring, compassionate men that I know. They say that you can't take care of people until they know how much you care for them. And so I think that he exemplifies that. You definitely exemplify that. So licensed chiropractor, certified acupuncturist, and speaking at conferences on natural health, nutrition, and a host of things, a myriad of things. Dr. Larry Ward, thank you for coming.
Thank you so much for having me. I'm glad you said that I'm one of your favorite, because I would hate for it to be so one-sided, because without a doubt, you're one of my favorite.
That's so sweet. We love each other, everyone. It's just
indeed. You come across people that are like-minded, that have a love for helping people, and you're it. And I share that heart with you.
Yeah, we definitely are kindred spirits, I'd say, for sure. So I have so many questions. We really want to start at the basics. Some of my patients are so far along in their natural health journey that they have their own chiropractors, or they definitely have experience going to different chiropractors. But so many of my patients have either been, I literally was taught in medical school that chiropractors were quacks. That is right. Literally was taught. And I don't know if it's appropriate to bring this up, but there was a lawsuit that the chiropractors won against the American Medical Association, was it? Yes. Or can you tell me that story?
Back in the 70s, it was, I forgot how many years, it was the Wilk decision. The whole point of the medical model being stymieing chiropractic. Chiropractic has been around for so many years, since 1895, but the point of that lawsuit was to give an even playing ground to stop the misnomers and the misrepresentation that the medical community was forcing themselves upon people, giving such misinformation about chiropractic, that it wasn't in fact until that lawsuit that they had them cease and desist the whole slanted attitude against it.
Yeah, for sure. And so going into the healthcare field, as I did, I just became so enamored of your colleagues and yourself, because I would go to meetings that were so interesting and on the cutting edge of medicine, and you guys would be there knowing your biochemistry better than I could remember it. So I've learned to rub elbows with the chiropractors in order to help my patients, because there's a wealth of knowledge there. And so a lot of my patients don't really know, because they, maybe they've been afraid to go to chiropractors. Some of them think that, and, I thought for many years that it was all just popping bones or things like that. Not necessarily. So what, can you tell us what you do?
Well, the whole point with chiropractic is we're addressing the nervous system. And the nervous system is what controls and coordinates all of the organs and structures of the human body. So if we are addressing the nervous system that's in control of everything and correcting any abnormalities that may be interfering with that, then we're affecting the representation, or affecting the entire structure, outward appearance, as well as physical function of that human condition. So as chiropractors, we correct what we call subluxations. We correct those subluxations by adjusting vertebral bones, structures, to address everything from hay fever. C3, C4 affects hay fever, to C7, T1 affects thyroid glands, to the 3 areas of the body, cervical, thoracic, and lumbar vertebra. By correcting the misalignment or the subluxation of those, we're able to allow the body itself to express itself like it's supposed to.
Right. So the subluxations are, and correct me if I'm wrong or add to this, but they are going to make the opening for those nerves more narrowed or kind of misplaced. And so when you align that correctly, that kind of takes pressure off of those nerves.
You bet. People don't understand that pain is the indication of, hello, can I have your attention?
Mm-hmm.
And that's the body screaming, it's getting close, it's getting close, it's getting close. And how do we feel when somebody's in our face?
Yeah.
The closer they get, the more uncomfortable we are. So consequently, that's the nervous system saying, whoa, we're getting a little too close here. So the weight of a dime weighs nothing, but the weight of a dime laying against a track of the spinal cord can kill it. So it's screaming long before it ever gets to that point of actually contact. It's screaming, I've got to have some relief and help, do something. And that's what the body is doing with the pain fibers, giving the nociception response to the brain to say, we need to do something.
Right, right. And, with my training, I'm not an osteopath, but I do know that the DOs get some training in, this kind of thing. But in the MD training world, we had really no training about how to correct these kind of things. And so I'm frequently, seeing patients who will maybe have a chest pain or feeling of reflux, even though they're not having reflux symptoms. And I can tell now from, years of practice and feeling my patients that maybe they have a rib out of place, but not knowing how to fix it. I'm frequently, trying to help my patients find a solution, find a chiropractor, someone that can put things back in place. And some of my patients' fears are, that some of us are afraid of like having our neck popped or something, a little vigorous that makes us feel out of control. So can you kind of explain the process of what we would experience if we came to see you?
Well, for example, that the bone popping noise that people hear is called cavitation. And cavitation is nothing but air escaping from a joint. So when we reach for something and our knuckles pop, or we move and our knees make noise, that crepitus, that cavitation noise, is there's too much pressure in that joint. So if we relieve the tension and pressure in that joint, then we're allowing that alignment to be as it is. That equates the sound of pop or cavitation, and that scares people. Mm-hmm. The whole point and misnomer of adjustments is what's called a cervical break, where they very rapidly move, can possibly 1 in a million occlude an artery and cause a problem.
Sure.
1 in a million. That's why I don't adjust people that way. I don't even take that 1 in a million chance, but I do adjust by hand. I hear all the time, why do so many chiropractors have different ways of adjusting people? Well, we don't all come from the same paradigm. We come from the paradigm of correcting the spine as we are taught, and then we evolve with the technique that best suits our abilities. So I adjust by hand. I don't use, there's a little clicky device called an activator that some doctors use that and are so efficient in that they don't do any hands-on adjustment, or they may do different types of specific upper cervical adjustment. The whole point is everything is affected by the brainstem. Everything's affected by the brain. So everything going through this area is going to be affected. If this is helped and corrected, subluxation is corrected, then everything below has an opportunity to express itself as it should. Doesn't necessarily mean it will when we've been hunkered over the garden for the last 5 days trying to plant and what was it, 26 bags of mulch I had to do recently. God bless my wife. All of that causes a backup, or it causes a misalignment that the muscles may pull tighter on one side, and the body is constantly wearing back and forth. We can address that with something as simple. I used to tell my students, I taught anatomy and physiology for 10 years, and I teach my students, if I could just get my patients to drink more water, I feel like I've succeeded in increasing their quality of life. Can you relate?
Yes.
So something as simple as hydration affects muscles, organs, etc. Something as simple as icing. We're taught, oh, put heat on something, but it's icing that reduces inflammation. We don't have a child with a high fever that we're going to put in a hot tub of water. We're going to put that child in a cool bath water. Yes. Same thing for the babies. Our muscles need that cool relaxation to help reduce that inflammation. Heat will respond to relaxing a muscle, but the inflammation that 90% of us have is affected more efficiently by the icing.
Yes,
so those are just the little things that make a difference.
I had a nurse practitioner friend of mine who had a cold laser and got a lot of response to decreasing inflammation with the cold laser treatment.
Indeed. So I use a cold laser, a class 2 laser in our program, and I'll utilize that. My 95-year-old grandmother, my son who just recently, he's 43, had shoulder issues. I'm not gonna twist and torque. I'm going to use that cold laser to help bring about that healing response more efficiently.
Yeah. So what does it feel like to have an adjustment then? Is it going to be painful?
Well, what is it? You go out on a blind date and you hear, but he's got a great personality, right? I can't say it doesn't hurt, because watching the response on some people, I have to tell you, I've been smacked. I've been knee-jerk reaction. I've been thrown up on.
That's not the common response.
Not the common at all. So I can say commonly, no, it does not hurt. It's that initial, but it's like, wow. People, I guess the most common thing people say, it hurts so good.
Yeah.
Because it doesn't really hurt to correct, but it's more of that scariness of what just happened.
Right.
So it's not painful.
Are there people who should not have an adjustment? Like, are there risks or adverse effects that we need to make people aware of? Or
well, the doctor should be aware of. Yes. I won't adjust somebody in the same manner that has a cervical fusion as I would for somebody who does not. But yet in the same sense, I adjust people with fused necks, fused low backs, etc., because the vertebra above or below that fusion then is taking the hit, and that has to have some relief as well. So we just alter how we're going to approach that and alter how we're doing that according to what history the patient may have or problem they have expressed.
Right. And I do have some patients who've had surgeries that are afraid, to go to chiropractors, but we also have the same patients who have those kind of fusions frequently will need another procedure eventually because of all the stress that it puts on the vertebrae that's below and above the fusion. So, which brings me to another question that I have. I know there are plenty of things we're going to get into that chiropractic can help, but can you also use it preventatively?
Absolutely. We call that maintenance care, preventative care. I've got some patients, gosh, when did I start? In 1997. I've got patients that I've seen since the very get-go that I'm still seeing once every few weeks. They've come to learn their body well enough to know that this is more than just muscle pain. Icing didn't help. I'm calling Dr. Larry, and I'll see him once every few weeks. It all depends on the extent of what we're doing out there in the world, as to the extent of how much care they need to correct the problem. Right.
But from what I understand, there's other things you can correct besides just musculoskeletal and nervous system.
Absolutely.
So
The
allergies and other things.
Absolutely. And because anything that the nervous system affects, we're affecting.
Right.
What's not affected by the nervous system, right?
Exactly.
Our founder of chiropractic has had a son by the name of B.J. Palmer, and B.J. Palmer, being the kind of developer of chiropractic, said there are three major causes of subluxation: thoughts, traumas, and toxins. Well, when you think about that, thoughts, traumas, and toxins, that incorporates everything. Yes. So everything is affected. We know, to the extent of being able to have the flow of your garden hose when you're watering your plants. If your husband is stepping on it behind you, you're looking at the hose going, what's going on? That's the same thing as a subluxation or an impingement on a nerve, not allowing that correct blood flow. The plants aren't going to get watered correctly.
Right. So are there certain conditions you've had more success with treating, or something that you would say is, just a shoe-in for coming to see you? What kind of things have you been the most successful at treating?
That's a tough question, because I have such a plethora of patients from all walks of life, all types of maladies. It's the ones that come in repetitively. I can just see by the way they walk. So this was a gardening day, yes. We can tell by repetition and getting to know patients, just like you do. When we get to know our patients more readily, we're able to know how to best address those issues. But we see neck pain, headache, shoulder. I hear a lot from women because of your anatomy that somebody's sticking me, somebody's stabbing me. And it's nothing but that misalignment, that head forward posture that's causing that constant strain and stress on that mid-thoracic, mid-scapular area. So just as many times I see somebody limping in, addressing having hip pain or low back pain as I do neck pain, or I got a rib out. We pretty much address it all.
Right. And so what I really want my patients to understand is that it's not just musculoskeletal issues that they would come to you for. For instance,
Correct.
A lot of my patients, we have several mutual patients, and a lot of my patients come to you for the training that you've had in nutrition. It just bears to bring up the fact that we had less than 2 hours in med school, if that, based on nutrition, right? Because, my education was one long drug company commercial, honestly. And, the educational system for the MDs and maybe the DOs as well is pretty much, got a stranglehold by the pharmaceutical companies. They give the money, so they, kind of dictate the curriculum in some ways. But all that being said, my patients have come to you for changes in their nutritional basis, for weight loss, for decreasing inflammation, which we're learning now is, and you guys kind of have known that for a long time, but inflammation is the main cause of aging and pretty much everything, really.
Yes.
And
when we look at it from that standpoint, in school, we're both, you and I, just getting our feet wet on understanding. Most people think, oh yeah, we've got thousands of hours, but it's that contact with the people. It's that understanding that the large intestines are affected by L1. Well, where did I learn that? As much as repetition out here in the field. But in chiropractic, we get approximately 380 hours more of anatomical sciences than an MD. But yet, in that same sense, those several hundred hours for you, we don't get in pharmaceuticals. Yes. Sure. We have more thinking of the whole system and the whole body. We have more nutrition and more structural anatomy, because we know that something as simple as C4 being out can cause hay fever. What? I mean, that the tension on different areas of the spinal cord and how the body functions are affected by those subluxations. So if we change that, if we change that juxtaposition, we educate somebody to increase their vitamin D, increase their vitamin C. Something as simple as people don't understand, there's only two mammals on the entire earth that don't make their own vitamin C. We are one. The other is some lemming in Madagascar or something, some mammal. But there's only two mammals that don't do that. So we have to ingest vitamin C. Otherwise, we don't function. But in the same sense, we need more vitamin C than just the infinitesimal amount to keep from having scurvy, right? The pirates had vitamin C to keep from having scurvy, but that doesn't mean we have optimal health. So the numbers that people come to me and say, oh, I'm great because my doctor said my vitamin D is a little low, it's 28, 30 is the bottom number.
30, right. Mm-hmm.
Right.
But that's not optimal. That's to prevent disease.
Exactly.
That's the model that MDs kind of were taught, or, I didn't even know there was a different option of optimal health whenever I went to practice.
Right. And yet we call it healthcare. Well, what is healthcare? Healthcare is me being responsible for my own health. It's me being careful and being aware of what's affecting me. So if I apply that same concept to how I function in life, then I'm able to be in charge of me. And if it's not Dr. Google that's going to fix me, but in the same sense, I need to be able to be aware and research what is affecting this organ. Yes.
Right. And so that brings us kind of to what my whole premise for our podcast is, which is I want my patients to be able to know, they know they've got some kind of malady usually when they come to me, something's off. And I want them to be able to realize that, say it's intestinal health or hay fever or whatever, not just taking a medicine or, getting allergy shots or what have you, or not just changing your diet, but also opening up the blood flow and the nervous system affects your blood flow to that area can also be a positive action they can take towards putting themselves in a place to optimally heal. Right?
Yes, absolutely. And that's the key, is creating that optimal ability for the body to heal. What do we need? Is it something as simple as, did I say water? Yeah, something as simple as water, right? Something as simple as, there you go. I have water in my coffee cup. Mm-hmm. Yeah, right. Something as simple as that awareness allows us to be responsible for ourselves, allows us to ask the questions of, why is my eye twitching? Why is this going on? And relying upon that information, knowing, I had a doctor instructor years ago, he said, the awareness the little baby has when it cries knows its system more than I will ever be able to learn in a book. Because what does it do? It cries, it eats, it poops, right? Hello. If there's interference with something like that, we simply need to know what's creating that interference. Is it a hormonal imbalance? Is it a subluxation imbalance? Is it a nutritional imbalance? What is causing that imbalance? Correct it and let the body express itself the way it's supposed to.
Absolutely.
That's why I have that shared heart with you, because I know that's exactly how you look at your patients. What is it I need to know here to be able to help you be helped? What is it that is causing, if it's the same repetitive movement, if it's the same, some kind of historical data that gives us information to today of why that ear is having an issue, why is whatever it is expressing itself the way it is aberrantly rather than the way it should.
Right. And one of the things I've learned from over the years working with different holistic health practitioners is that the body will hold tension, not only just from pain, but it will hold tension based on emotions. So exactly. If we have something, kind of troubling us, some of my patients will store that energy maybe in their shoulders, or they'll have neck aches and headaches. And I'll frequently hear them come in and say, I just feel like I'm banging my head against a brick wall or something like that. Our intuition is kind of cool.
Yes.
And so my patients will have these, these symptoms like that could be related to, some underlying organ cause. I need to check their chest pain, or it could simply be that when they're in angst or worried, they tighten their chest muscles up. It's their protective response. And adjustments may need to be made based on that too. Or
I can't tell you how many times I've adjusted somebody and they have this release.
That happened to me.
Yeah.
Yeah, that happened to me once. I went for one of my business groups, a chiropractor that I worked with, Dr. Martinez. He adjusted me, and I felt tearful, which I can't explain.
And that's that change. We can physiologically talk about the change of intrathecal pressure causing pressure on the nerve. Blah, 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 blah. Bottom line, it's a release, right? And I can't tell you how many times you can't plan for it. It could be some muscle memory of the tension when dad smacked me upside the head because I'd done something wrong. And so every time I feel that tension, I feel that angst of tension inside or anguish, and that movement allowed the release of that. And so that's the memory of letting that go. It's just amazing.
It may or may not be conscious, it's
exactly.
At times it's subconscious. Maybe we should call this subconscious medicine, because there's a lot of that goes into it. A lot.
Right. Indeed.
So can you give us an idea? So first of all, does insurance cover any of your care?
No.
Sometimes it does, with patients who have car accidents and stuff like that.
Let me change that. I don't take insurance.
I got you.
Medicare pays like $16 for a chiropractic adjustment. I just soon take apple pies, or fried chicken.
That's right. That's right.
I don't take insurance, and that's why, because I don't want to be dictated to, like you. I don't want to be dictated to by an insurance company how to best serve my patient.
Understood. Yes. And so along those lines, a lot of my patients are cash pay because we try to help the patients who are either underinsured or uninsured, which is the vast majority of patients anyway.
Touche.
So they may want to know, like, how much do they need to plan for, like a range or a price range for their first visit, so that they can
we charge $85 for the first visit. Takes about an hour. That's all the history, the physical exam, determining from that how best to serve that patient, taking in mind all of the lab work that they have or something to bring in for chiropractic care. And each visit thereafter is $50. And the girls at the front desk work with people. However, my heart, if I could have a box on the wall and stick some money in there, I would take it and do fine with. But I want to make it affordable to people. However, I don't want that, like you, I don't want that to be the reason they don't get optimal care. Right.
Exactly.
So we have such a wide range of things that we do. Acupuncture, I wish I could tell you, I think the girls charge $35 or something for an acupuncture session. If it's chiropractic and acupuncture and they're going to be here an hour doing infrared sauna, it might be $65. But we try to keep that in the price range. A lot of people's deductible nowadays is more in their insurance than what we charge for an initial visit or care.
Yeah, that's beautiful. I mean, my patients love knowing it takes a lot of the fear out. Frequently they'll go to a specialist who takes insurance, because most specialists do, and they won't be able to tell them how much it's going to be. They don't even have any idea
right
how much the price of their visit will be. And that's very scary for people to be, go be seen and not know what kind of bill they're going to have afterwards.
Right. So exactly.
That makes it much more convenient for people to understand. So what would you like my patients, the community, to know, going forward? I want to make sure I get all the questions in. We're going to be wrapping up here, so I want to make sure that you get to speak about what you're passionate about.
I'm passionate about seeing people and getting invited to weddings and getting invited to christenings because I've been doing this so long. I'm getting invitations to things like that from my patients. That's exciting to me to see the lights come on in that patient and knowing that we've improved their quality of life. Yes. I know we share that. We do everything from chiropractic care to we do IV therapies. We do nutritional IV support with vitamin C, EDTA, those things that help what we call chelation, helping the system and be supported in a plethora of abnormalities that may be going on. Dr. Thomas Levy, MD, wrote a book called Curing the Incurable, and he's also written a book called Rapid Virus Recovery. And he's kind of the guru that carries the baton after Linus Pauling for being our expert in the world on vitamin C. And as he puts it, there is nothing that can't be affected positively by vitamin C IVs. So we do that as well. We have a weight loss program. We have a Zerona Z6, which is the weight loss laser. It's very effective. The FDA, oh boy, the FDA cleared it.
That's great.
The FDA clearance of 3.72 inches, I think, in a program. We're actually averaging about 5.5 inches of weight loss with. So we're far above average. We want to help and support our patients in any way that we can. Running lab work, or if it's something that I can't do, I'm sending them to you.
Right. And that's one of the things I love about you is, if you get a patient that is having chest pain or something and you want to make sure that they're cleared, then, we can do that.
Indeed.
But I love that, each one of us comes to you for something different, and it may be, digging down to the root cause of that may be completely different, even though we have we may have the same symptoms, but the etiology could be completely different. We may need detox. It may be more related to inflammation or, a nutritional deficiency. And so figuring that out for each patient takes a little bit of time and finesse, but that's exciting to me that we can put patients in an optimal state where whatever I'm doing to try to help them, we're supporting that with all these other modalities.
Touche. And that's what I tell my patients. Your headache is not a lack of aspirin. Let's find out
in aspirin.
Right. Let's find out what's going on. And it may be hormonal imbalance. It may be electrolyte imbalance, maybe water. Hello, did I say water?
Yes.
It may be something simple that they're doing or not doing. And if not, it may be something that the body is trying to say, I need your attention on something else. So when we work together, the patients are the ones that have the corrective issue that we can help usher in. Yes.
Yeah. And, we haven't classically worked together. I can remember being in a meeting, not you and I, but just doctors and chiropractors.
Yes.
But I was in a meeting once where, I got kind of quizzed about why was I there? Because I'm so curious about what you guys do. And so there was a lot
Are you a spy?
Yeah, there was a lot of distrust or concern about how they, they didn't feel as free to speak with me there because, and we have a completely different language. It's like babble.
Yes.
The chiropractors may say someone's leg length is shorter, and to a MD with our training, that sounds hocus pocus.
Right.
But when we begin to understand that the muscle tension on one side is tighter, or whatever we're trying to understand, then we can make progress for our patients if we can sit down and come to this kind of understanding.
Come to that conjunction that's going to make a difference. The best example I give you is my grandmother. She, as you know, most people that have a broken hip, their hip breaks is what causes them to fall, not vice versa. And my grandmother actually broke her hip when she fell out of the steps of the fifth wheel trailer that she and my grandfather were camping. She fell, she went in, and at her age, they didn't feel that they could properly fix, so they replaced it. Well, they replaced it without thinking the fact that she just fell out of a motorhome. So when they replaced it with her hip cocked. So I come along And I check her and she's hobbling and walking and having back pain, and I x-ray and check her out. This hip is 1.25 inches. This left side is 1.25 inches shorter than the other when I align it.
Mhm.
Then what am I going to do? They've replaced that hip 1.25 inches because they didn't take in consideration the full picture.
Mhm.
That's what I love working with you is we're looking at the whole picture. How can we best help that patient overall?
Excellent. Yes. And I think that's where we're coming to. We're going to get to that place where what your field has learned and what my field has learned is going to come together to better serve our patients.
Well, we do. And if we can be an example out there in the world, look, goosebumps.
Yeah, me too. Yeah.
It's exciting to me to think who suffers today, the patient, if we're not on the same page, who can benefit the patient. And that's our goal.
And that's honestly, I think why we as MDs went into this as well. And we just weren't given the tools, all the tools or all the education that we needed, hence this moment right here.
Indeed.
So, all right. Well, thank you, Dr. Larry Ward, everyone from Natural Health Associates. They're located at 5460 South Garnett Road, right? 918-794-0310 for any of my patients who would like to make an appointment. And we look forward to many more talks like this. Dr.
Indeed.
I appreciate
Blessings to you, Melissa. Thank you.
Thank you.
Wade, I want you to know you will always be an endeared friend, but you're also an honored colleague, and I appreciate you.
Thank you. You as well. All
Take
right.
care.
Take care. Bye, Dr. Ward.
Bye-bye.